Hi, good evening, everyone. Thank you for joining us. We're here tonight for the COVID-19 Community Town Hall, which is presented by UP Health System Portage. I'm Steve Elmer on behalf of the Health Research Institute here on the campus at Michigan Tech University. I want to welcome all of our viewers watching tonight on Zoom and on Facebook Live, and all of our listeners tuning in on 97.7 The Wolf. It's great to have you with us for another town hall. In just a few minutes, I'll be joined by my colleague and co-host, Dr. Kelly Kam, who's our epidemiologist here on campus. She'll provide some input and analysis along the way. So looking forward to having Kelly come on here in just a few minutes. Need to recognize our sponsors for tonight. Our series sponsors, as I mentioned, includes UP Health System Portage. Additional sponsorship is from the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, and the Physiological Society. We appreciate all of the support from our sponsors for helping make our Town Hall series possible. The Town Hall series is organized by the Health Research Institute, along with additional support from the Center for Educational Outreach. The mission of the Health Research Institute is to support health-focused education and training for our students, research for our scientists, faculty, and engineers on our campus, and also to support health-focused education and outreach for the community. Tonight is our 7th Town Hall in a series of 12 that we're having every Thursday evening right here on Zoom, Facebook Live, and the radio. The goal of the series is to increase our awareness about COVID-19 and how it impacts our health, the health of our community, and the health of society at large. Tonight's topic will focus on the role of mental health and how the pandemic is impacting our mental health. This is a great segue from the last town halls. We focused on how the pandemic is impacting us, our physical health. Remember, if you missed any of our previous town halls, you can go to our website. They are free and publicly available. That website is mtu.edu/health-research. When you're on the page, just click on the word Town Hall. You'll be able to pull up all of the previous town halls. You can download them and watch them at your convenience. Next, I want to bring in my colleague and co-host, Dr. Kelly Kam, who again is our epidemiologist here. So Kelly, great to have you back for another town hall. Look forward to the town hall tonight. And tell us a little bit about what's coming up and who's going to be here tonight.
Yeah, absolutely. So as you mentioned, we're going to be speaking about mental health, and this has come up at quite a few of our previous sessions that we've had, thinking about different community members and different population groups that are likely suffering from mental impacts of this, both the disease itself as well as the impact and the response to it. So it came up with thinking about our hospital and our medical providers, as well as our public health departments, and as well as everyone in the community. So we have 4 speakers tonight. We have Leslie Griffith from Copper Country Mental Health, Amber Bennett from Michigan Tech's Student Mental Health Center, Kevin Treewortha from the Department of Cognitive and Learning Sciences, as well as our own home department of kinesiology and integrative physiology. And then we have a 4th speaker that's a guest from a local recovery community. They'll be able to speak about some of the impacts within the recovery community that are really important and quite a challenge, as I would expect.
Thanks, Kelly. You know, we certainly timed the town hall tonight with our partnership with 97.7 The Wolf Radio. On the Q&L report today, there was a very timely article about how our local Copper Country Intermediate School District is developing a student mental health program. This was just out earlier today, so certainly aligns well. This is an important topic. I know you have a couple of other COVID and public health updates. So Kelly, tell us a little bit more about talking about this infodemic curve here. I see that you're displaying and explaining to our listeners out there as well.
Sure. So we've put up some slides previously in other sessions looking at some of the mythbusters from World Health Organization. And the idea of this infodemic, that there's just so much information out there and not all of it's reliable. And what part and what role do we play as individuals in stopping that, the spread of misinformation? Because several of our speakers throughout almost all of the sessions have indicated that misinformation is a huge problem in fighting this pandemic. And so this is from an epidemiologic perspective. We look at these as from an infection, spread of infection, and what happens when you are able to stop the spread of the disease, or in this case, the misinformation, when you stop it upstream, how much of an impact it could have. So you can see if there was no stoppage of this misinformation all the way over on the right, that kind of feathery looking, all those people that would get that misinformation. And yet, if there are people who are stopping it, not spreading the rumor on their Facebook pages, or there's other social media pages. They're checking their facts and understanding what's true and what's not true, and stopping the spread of things that are not true. Using some of those trusted and reliable sources for where they're getting their information of, and then asking around. So asking people, how do you know it's true? They said something is not really a reliable source. So we really need to think about what are those sources that we're getting it from, and ask those questions. It can be awkward and it can be uncomfortable, but we need to do something to stop this infodemic, and asking those kinds of questions, doing that kind of research. We need to all be consumers that are thinking about what we're consuming with the information on this.
You know, Kelly, you're exactly right. As our role as scientists here and members of the Health Research Institute, we feel it's so important to help leverage our background and our expertise to help get the correct information out there. And we'll see tonight bringing in our other experts to serve on the panel that they will help us too in the context of mental health. I know we have a few helpful resources. We've been adding these each week. Can you just quickly walk us through for our listeners and viewers tonight, Kelly?
Sure. So these different websites have lots of information, both on the statistics and the information about how the disease is spreading and how the pandemic is moving along through our populations. So you can look at that from the global perspective at the World Health Organization, at our federal level at the Centers for Disease Control and Prevention, at our state level or other states. If you're from other states, your state websites, state departments of health and human services, and your local departments of health all have that kind of information. Many of our health providers, as well as health providers in the areas that you live in, are going to have information on accessing care in these different areas and how that's changed with COVID, as well as tips and tricks for keeping yourself healthy in this time. I would like to mention, just to give you an update on some of those numbers that are available on those different sites, that we are globally at 41.5 million cases, and unfortunately over 1 million identified deaths due to COVID. And about 8.4 million of those cases are in the United States. And we now have over 220,000 deaths that are directly related to COVID. Although a recent publication from the CDC indicated that there's an excess of almost 300,000 deaths above what we normally would have seen in the period from January to October. And so some of those deaths, about 215 to 220,000 of those deaths are directly due to COVID. The others are deaths that are related to COVID that would not have happened likely if we didn't have COVID. So those are other things that people are dying from, say a heart attack that couldn't get into the hospital because there were no available beds.
Thanks, Kelly. I just want to add two other websites that we've added. We've had community members ask, you know, can we give a plug for those? Absolutely. Here, one is the Copper Country Strong website, coppercountrystrong.com. A lot of useful updates especially for the 5 counties in our surrounding area. And then also last town hall, we heard from a team of Michigan Tech students working on an initiative called Up and Moving. Go to upandmoving.org to find more resources about staying physically active and some free online exercise workouts as well. So we'll continue to add to this list each week. So to start off our town hall, it's my pleasure to welcome in Leslie Griffith. Leslie is the Outpatient Program Director at Copper Country Mental Health. So Leslie, it's a pleasure to welcome you to the town hall, and thanks for being here tonight. I know you're going to tell us a little bit more about how the pandemic is impacting mental health, and especially here in the Copper Country.
Yes, thank you. Good evening to everybody. I'm going to talk a little bit about common reactions that people may be having, as well as some coping skills. Pandemics are stressful for everybody. Anxiety and fear are common reactions to the unknown, and this can become overwhelming to people of all ages. A recent CDC survey reported that nearly 41% of respondents said they were struggling with mental health issues stemming from the pandemic. Of that 41%, people reported at least one behavioral or mental health symptom, including substance use, depression, and suicidal thoughts. In another CDC survey, they found that the number of people struggling with anxiety right now is 3 times higher than the same time last year. And we know that this is hitting people of color the hardest. Public health strategies like social distancing can result in feelings of being lonely and isolated. And as I get into some of the common reactions, I want to mention that the reactions that people are having are going to be based on their own experiences, and we're all going to react differently. Some of the things that may impact how people are experiencing this are related to things like their own health needs, including physical health, mental health, and substance use. If they're caretakers, if they're essential or frontline workers, and people who may be already socially isolated. So some of the common reactions that people may be feeling right now are fear and worry about your own health, as well as the health of your loved ones, concerns about your financial situation or your job, as well as the real loss of support systems that you've relied on in the past. A lot of services are now being provided virtually, and they're just being done in a way that we're not used to. Other reactions are changes in sleeping or eating patterns, difficulty concentrating, difficulty sleeping, worsening of chronic health conditions or mental health symptoms, as well as an increase in the use of tobacco, alcohol, and other substances. So given those reactions, I wanted to talk a little bit about ways that you can cope. So one of the first things is realizing that we need to balance our own needs in order to then provide support to our loved ones and other members of our community. A common analogy we use in the mental health field is the oxygen mask on a plane. You know, the flight attendant will tell you to put the mask on yourself first before you help others around you. And that's true in this situation. If you're not taking good care of your own mental health, it's going to be hard for you to provide support to others. Additionally, we need to be connecting with others. So we're social beings, and social connections are so integral to who we are. But we just have to find different ways to connect right now. So using video platforms, phone calls, texting, even writing an old-fashioned letter or a card to somebody is a way to make a connection. Children can participate by drawing a picture and mailing it. Another coping strategy is maintain a routine. When we're in the unknown, if we can provide a known for ourselves, that will help us in day-to-day living. Additionally, take care of your body, and this is done in many different ways, making sure you're getting good sleep, you're eating healthy, getting exercise, and avoiding alcohol and other drugs. Additionally, we recommend that people take time for themselves every day through self-care. You can take deep breaths, and that's a minute or two out of your day, or meditate. There's a lot of really great free meditation resources out there. Headspace was one that the state of Michigan had provided free for Michiganders. There's also apps like Insight Timer and Calm. And take time to do things that you enjoy. You know, try to find that pleasure in life. And then the last coping strategy I have is limit news consumption. It's really easy to go down that rabbit hole. The last area that I briefly wanted to talk about is something that we are seeing in the mental health field is suicide risks. Feelings of isolation, depression, anxiety, and other emotional and financial stressors are known to raise the risk for suicide. And people may be more likely to experience these feelings in a crisis like a pandemic. Just in the last week or two, the Journal for the American Medical Association published an article saying that we are likely heading into a second wave of raising rates of mental health and substance use disorders. We're likely to see increases in suicide and substance abuse, as well as there's a real concern for prolonged grief for community members, as well as symptoms of post-traumatic stress. So as I kind of wrap up here, I just want to say that if you're concerned about someone who is suicidal and they're an immediate risk, call 911 or go to your local emergency room. We have resources locally to assess someone who is suicidal. If it's not an immediate risk, we have the Dial Help Crisis Line locally, as well as there are national crisis lines. And many of these have the ability to text if you don't feel like talking. We do have a lot of these resources on the Copper Country Community Mental Health website, as well as our Facebook page. If you go to our website, we have a whole section separate for COVID.
Okay, thanks, Leslie. Just going to start with a quick question here. So if you do have a family member, a child, or somebody, a roommate that you sense they are struggling with some mental health right now during the pandemic, what advice would you have? Where to even start? How do you approach them, or how do you even bring up the conversation?
I would start by saying that you're concerned with, how they're presenting, and is there something that you could do? And if you feel like that's not helpful, I would say that you could reach out to some of our local resources. If it's on the tech campus, there's definitely the Tech Counseling Center. In the community, like I said, there's Dial Help. At Mental Health, we're always willing to talk to somebody who is just looking for direction of where should they start. But again, if it's an immediate risk, I would call 911 or go to the local ER.
Okay. Just want to follow up. What would you say for folks who, might be trying to seek out some resources, but that are worried about cost, insurance, et cetera? What advice would you have for those individuals in general?
There are lots of providers who either have a sliding scale or will do work pro bono. So I would say, reach out and see what's available. I know we have a private provider list here at Mental Health, and I'm sure many other places do also.
Okay, thanks, Leslie. We will definitely circle back with a few more questions a little bit later in the town hall. For those that are just joining us, we're here tonight for our COVID-19 Community Town Hall. It's presented by UP Health System Portage. Our topic is how the COVID-19 pandemic is impacting our mental health. We just heard from Leslie Griffith, and we're going to move on to our next presenter. As you're formulating your thoughts and your questions, you can send us those questions two different ways. You can, for those on Zoom, you can use the Q&A button at the bottom and send us your question. If you're on Facebook or listening out there on the radio, you can send it via email to townhall2020@mtu.edu. For any radio listeners out there, if you would like to join us and see some of the visual content, if you go over to thewolf.com, you can click on the link to join us either on Facebook or on Zoom. Okay, our next presenter, we welcome in Dr. Amber Bennett, who is the Director of Student Mental Health and Wellbeing here at the Michigan Tech University campus. So Amber, thanks for being with us.
Thank you for having me. And I'm very happy to be here. So tonight I'm going to just make some remarks. I'm going to echo a little bit of what Leslie shared as well, but focusing more on the college student population, and then also a little bit on the K through 12 population, because obviously the youth in our community are really important, and they are also enduring this pandemic. And so it's really important, I think, to be aware of what their struggles may be as well. But with regard to the college student population, this year is very different than it has been in any year that I've worked in higher ed, and I've been at Michigan Tech for just about 7 years now. And I think we're all going into this situation really with a lot of anticipation and a lot of unknowns. And that means our college students have kind of approached it in the same way. And even in talking with colleagues, so college is full of transitions, and we talk to college students about that all of the time, that when we're in the middle of a transition, we know that mental health concerns are going to be exacerbated. It's just a natural piece of having a little bit more anxiety, a little bit more worry about the future. And so we're seeing a lot of that now because we're in a constant state of transition. And so the age of onset for most mental health concerns actually happens right within those college years. Anywhere between 15 and 25 or 18 and 25, depending on the study that you look at. And so based on that, and I think that Kevin, one of the other speakers, is going to talk about this a little bit as well in terms of brain development, that college students don't have the same brain development, nor do they have the same experiences of adults within the community. And so they're also away from their primary support system when they come to college. And so we're seeing some of those other pieces as well. Generally, as you get older, you have a little bit more dexterity, you have more life to draw upon. And so you can reflect on kind of what life is going to hand you and to anticipate and to utilize a lot of really good coping skills. But some of the things that we're seeing that we haven't necessarily seen before are different challenges that each of our class years are facing. And so we anticipated our first year students struggling a little bit because they don't have the same opportunity to socially connect that they maybe did before in terms of being in the residence halls and having their doors open and meeting people. However, I will say on campus, I think our student organizations, our residence hall staff are doing a phenomenal job setting up activities, getting students out and having them do things. There are just in some ways some physical barriers that are preventing that of doors being closed. And so that means that college students are going to have to push themselves a little bit more to extend themselves to socially connect in the same way that Leslie was talking about. And that's really important. Within our second year students, we're seeing a lot of grief and loss of their first year. You know, they came in with a pretty typical college experience and enjoyed that. And then in March, that experience changed pretty tremendously. And then coming back to campus, things were pretty different than what they had experienced that first year. And then our third year and fourth year students are experiencing a lot of worry and panic about job opportunities, about internships, and what things are going to look like upon graduation. And so all of these things feed together to again really enhance some of the mental health symptoms that they're experiencing of anxiety and depression, loneliness, feelings of disconnection, and really just that concern about the future and what things are going to look like. You know, a couple of weeks ago, there was an NPR broadcast that talked about loneliness and how in certain areas, we're seeing increased rates of anxiety, we're seeing increased rates of depression, but studies that are being conducted right now haven't necessarily found that loneliness component. And I think in some ways that's because a lot of us have been with our families, we've been able to be at home, we have people that we're interacting with. So the anxiety and depression are there because of the current state of everything, but the loneliness maybe isn't there in the same way. But I think for college students, that's different because they're not within that same support system that those of us who are in the community or who are at home with family may have. And that's a really important factor to take into consideration. With regard to K through 12, you know, our kids are such an integral part of this community. And I say that as a parent of 3 kids who are enrolled in K through 12. Again, I think our school districts have done a phenomenal job of being careful and being cautious, working with our kids, keeping them safe and getting them into school, whether kids are at home and doing school at home or whether they are physically at school, and keeping in touch with them. But our kids' routines have been completely disrupted in a lot of ways. When schools had to take that 2-week pause, again, I think it was needed in terms of protecting the health of our community. But this is kind of that place where parents come in, and it's the same conversation that we have with college students of maintaining a routine is really, really important. Of having a time when you wake up in the morning and having a schedule of things that you're going to do during the day, building self-care into that is really important as well. And maintaining connection, like Leslie talked about, is critical as well. In whatever way that happens is really important. I think for children in particular, having parents, having grandparents, having other people check in with kids and willing to have the conversation of, how are you doing? Tell me how you're feeling about all of this. And kids, even as young as 4 or 5, can talk about this. They can talk about how they're feeling. You know, sometimes they draw it out, sometimes they act it out, but being willing to engage in that conversation and really validating how kids are feeling, and reminding them that we're here and that we'll talk to them and we'll support them is going to be a really critical piece along the way.
And we're going to start with a question here. I want to circle back to the freshman students that you talked about being here on Tech or any campus and really being isolated. You know, and that is something very different, right? They're not building those relationships, making those connections, meeting as many people, especially if they're new to the UP. How can we help them a little bit more, not just through student organizations, but other things, maybe staff or faculty or resources through your center, just so they don't feel so extremely isolated, maybe just in a dorm room with another roommate?
Yeah, so I think especially when we become aware of somebody who may be struggling, that personal outreach, I think, is critical, of sending an email saying, hey, can we set up a time to chat, whether it's on the phone, whether it's Zoom. Telehealth, I think, in a lot of ways, if we reframe some of the things that are happening, telehealth has been instrumental in terms of getting care to a lot of people who maybe would not have accessed it previously. And that is something that can happen in a lot of different ways. Like I said, whether it's on the phone or whether it's through a telehealth platform. But there are faculty and staff across campus. There are people within the community. We have a cooperative campus ministry group as well who have offered their services. They've extended their willingness to connect with individuals as well. So some of it is recognizing that. And again, within the residence halls, I know the RAs, so the paraprofessionals in the hall, they're also doing a tremendous job reaching out to students and trying to get them out of their rooms. But that personal connection, that conversation, that opportunity to talk about and to check in and to say really directly, how are you doing? And willing to talk a little bit more in depth of how are things going? Opening up that conversation can be really critical.
Thanks, Amber. We're going to circle back with a few more questions as we get to about the halfway point. We'll come back with more questions for both Amber and Leslie here. Moving forward, we're going to welcome in our next presenter. We have Dr. Kevin Trewartha, who is an assistant professor in the Department of Cognitive and Learning Science here at Michigan Tech University. So Dr. Trewartha, we appreciate you being here tonight. And I know you're going to shift gears slightly and talk about COVID-19 and how it's impacting cognitive function.
Yeah, so thanks for having me. I'm glad to be here. So as Steve said, I'm not a clinician or a neurologist, but I'm a scientist and I study brain and behavior. And even though we tend to think of COVID-19 as a respiratory illness, I became really interested in the fact that there seem to be broader effects and effects that are the virus, the SARS-CoV-2 virus is having an effect on the nervous system as well. And I sort of think of this in two different categories, direct and indirect effects of the virus on the nervous system function. So I'm going to just talk briefly about that. And then at the end, I'll kind of tie that into what Amber and Leslie have been talking about in terms of mental health. So we know that SARS-CoV-2 is a virus that takes over cells and replicates itself and deprives other cells of oxygen, causing cell death. We know that happens in the respiratory system, particularly in the lungs. And we expect that this could happen in brain cells as well, so in the neurons of the brain. And in fact, there's some research out there now, especially with animal models and mice, suggesting that that is indeed the case, that this virus can impact neurons as well. And we also know that there are documented changes in terms of the connections between neurons. So the communication between different neurons in the brain is reduced as a direct effect of this virus potentially. But there are broader impacts of the virus that I think are important that it has on the brain. One of which is that there seems to be evidence that the virus itself can increase the chances of people having a stroke. And that's related in part to the fact that there are blood clots that form as a consequence of this virus, of an infection. And those blood clots can get into the vasculature of the brain, as well as bleeding of the brain, and both of which can cause strokes. We also have, because it's a respiratory illness that comes with shortness of breath and difficulty breathing, of course, we have hypoxia or reduced oxygen levels in the body. That's true in the brain as well. And so that can lead to damage and dysfunction of the brain. So we know that there are sort of a number of symptoms that we might classify as kind of neurological symptoms for individuals who develop COVID-19. One of which that's relatively common are headaches. Another one that people experience and report is sort of brain fog or confusion. In really severe cases, of course, with reduced oxygen levels, people can lose consciousness. And then one of the more interesting ones that seems to be a relatively common symptom of COVID-19 is the loss of smell and taste. And we don't know exactly how that symptom emerges, but it could very well be a neurological condition. So it may be that the virus is impacting the peripheral nervous system and causing changes in smell and taste. And we know that those changes do happen in other neurological conditions like Parkinson's disease, for example. There are other symptoms that are related to neurological dysfunction that seem to be more rare, but are being documented now in case studies around the world. One of which is delirium, which is sort of a more extensive confusion and disorientation, often comes with emotional disturbances and agitation. This is actually fairly common in fever, especially high fevers, especially in older adults. And we know that those older individuals are at higher risk for severe complications in COVID-19. There's also been documented incidents of a syndrome called Guillain-Barré syndrome, or GBS, resulting from SARS-CoV-2, which causes damage in nerve cells, and it leads to weakness, numbing, burning sensations in the limbs, in some cases even temporary paralysis. And then there are additional conditions that have been identified related to the disease, inflammatory conditions, one that's called ADEM, which happens because of a rush of immune cells into the central nervous system, and that leads to symptoms like fever and fatigue and nausea and headache. And then there have also been some documented cases of the virus causing seizures in individuals as well. So they're quite systemic changes that can happen in the nervous system. Some of those changes lead to changes in cognitive function, which is my particular interest. But of course, for scientists and clinicians, what we really want to know is, why are these brain changes happening? And currently, we just don't know. We don't know enough about the virus to understand that entirely. One possibility is that the virus is directly infiltrating neurons in the brain. That would require that this virus can cross the blood-brain barrier, and we don't know for sure that it can. There is some limited evidence that that is possible, including a handful of case studies that showed that you can detect the virus in cerebrospinal fluid, but a lot more research is needed to be able to determine if that's true. The other possibility is that it's related to inflammation that's simply caused by the immune system's response to the virus entering the body. And that inflammation could cause changes in neural function in the nervous system. And it's probably a combination of all of those, that there's the body's immune system's inflammatory response is causing problems, that lower levels of oxygen getting to the brain, changes in blood vessels, and maybe even just the effect of severe illness. The fact that you've got a severe illness, if you're a severe case of COVID-19, can have detrimental effects on nervous system function. And then really what's, I think, kind of interesting and worrisome is that we don't really know the long-term neurological consequences of this virus yet. We're going to need a lot of longitudinal studies over the next number of years to try to understand and document the consequences of the virus itself. So these are things that I think of as sort of direct impacts. This is what happens if you contract the virus, and especially if you happen to contract the virus and it does impact the nervous system, and it may not for all individuals. The other one that I want to do, and this just ties it back to what Amber and Leslie talked about, are what we could consider much broader and sort of long-term indirect effects of the virus. And not just the virus itself, but just living through a pandemic. So this kind of speaks to what Amber and Leslie talked about. We know that this living through a pandemic leads to elevated levels of stress and depression and anxiety in a lot of people. And we also know, putting COVID-19 aside, stress, depression, and anxiety is associated with physical changes in the brain. We know that there's shrinkage of the brain, so atrophy occurs, loss of neurons, changes in brain connectivity, where different brain areas don't communicate as well as they used to. We know that those physical changes are associated with the severity and the length of the mental health condition. And this especially happens in areas of the brain that are involved in memory and attention and decision-making and emotional processing. And what's important there is that there are real cognitive consequences of just living through a pandemic, and that's true for people who may never even contract the virus itself. And I think our understanding of these broader implications of living through a pandemic are going to change over time as we learn more, and that's going to be an important part of our longitudinal research associated with the impact of SARS-CoV-2.
Kevin, I want to move back to those direct effects that you talked about on the nervous system and the brain. Some of those were quite severe. Do we know what percentage of folks that contract the virus are experiencing this? And I guess what I'm getting at, if there's millions of cases, even if it's a very small percentage, that's still tens or 20 or 50,000 people. I mean, can you just elaborate on that a little bit more?
Yeah, so I don't have numbers in terms of especially the more severe conditions that are associated with the virus. There certainly some of the common symptoms happen to a lot of people, like the loss of taste and smell, headaches, fatigue, and high fevers. And so some of the cognitive changes and most of those changes will likely be temporary. And once the virus is cleared out of your system, then you go back to normal functioning. The broader ones like increased incidence of stroke or seizures or other neurological conditions that are much more severe seem to be pretty rare. And in fact, most of the research that we have on the neurological impacts are based on a handful of case studies. So one of the larger studies that I was looking through, they only identified 24 patients that they were looking at. So this is probably relatively rare, and we don't know exactly which people are at higher risk of developing those more severe complications or not. So it's a great question, and I wish I had all the answers, but I don't for that.
Kevin, we appreciate the insight. We'll circle back here in a little bit.
Sure.
We are just about halfway through our COVID-19 Community Town Hall. I want to take a minute and recognize our sponsors. Remember, if you do have questions, you can send those in using the Q&A button if you're on Zoom, or if you're on the radio on Facebook, you can send us via email at townhall2020@mtu.edu. Our topic tonight is focused on how the COVID-19 pandemic is impacting our mental health. We've had 3 presenters so far. We'll have 1 more guest from the community coming up. Our sponsors include UP Health System Portage, the MTech Smart Zone, Upper Peninsula Power Company, the Physiological Society, and Aspirus. So thank you to all of our sponsors. We're going to move on to our next member of the panel. We're going to welcome in Jim. Jim is a guest from the community, and he's going to be representing our local recovery community. So Jim, welcome to the town hall, and tell us a little bit more about the group that you're representing.
Okay, thanks, Steve. It's good to be here. So I'm involved in a few of the self-help groups in the local community, and I'll talk about some of the groups that are available. One thing, just to follow on what Leslie had said, there was a recent study from RAND Corporation that alcohol consumption went up by 14%, and actually heavy drinking and they targeted specifically women increased by 41%. And so, we all use different ways of coping, and some of those are healthy and some of those are unhealthy. And addiction in many ways is just using some sort of substance or process or experience, to medicate feelings and emotions that become obsessive to the point of causing negative consequences, such as placing unreasonable demands in terms of time, finances, and some of the emotions that are often invoked by someone involved in an addictive process often are shame or resentment. In general, we like to say that, if your life's become unmanageable, you may have an issue with addiction. And so, and any of these times, like now with we have many things going on with the pandemic. We have all the cultural issues, the political issues, the economic issues. And so people will often turn to something to address that. And so we're very fortunate in the Copper Country to have many recovery groups available for people who are looking for help, including Alcoholics Anonymous. We have a couple of very strong Narcotics Anonymous groups. It's interesting to note with the increase in opiates and methamphetamines. And even marijuana, which I know is now a permitted substance, but that doesn't mean it's not addictive, that one of the largest growing communities are actually the folks that are going to Narcotics Anonymous meetings. So we have meetings for Overeaters Anonymous, Gamblers Anonymous in local communities. And for those people who are impacted by addiction but aren't addicts themselves, we have Al-Anon and Nar-Anon. Those are for people who are codependents or involved in a co-addictive relationship. And then also one of the other groups that's local, which is Adult Children of Alcoholics, for those people who are impacted. And for anybody who thinks they may have a problem with a substance abuse, whether it's alcohol or something else, one of the best ways to seek help is just to call dial help. And they'll get you to the right place in the right groups. Meetings are listed in the Daily Mining Gazette. And then also we have a local AA hotline, which is 906-482-7778. So, and again, I think if you have any concerns about having your life unmanageable or something, it's reach out and ask somebody for help. So one of the questions I was asked about was how have the local recovery communities responded to COVID? And the reality is that people find their way into recovery groups by many paths, and they come from all walks of life. Addiction really doesn't discriminate by economic status, race, gender, or creed. So at the fundamental level, our recovery communities have responded similar to the overall population, with one important exception, which I'll talk about in a moment. But as with just general society, there are mask wearers, there are people not willing to meet, there are people who insist on meeting, there are people who don't want to use masks. So really, there's no difference, I would say, in terms of the recovery community when it comes to the broad sampling of society. But we've also seen that people who have relapsed because their support system was disrupted. There was a period of time when we couldn't have meetings in person. And so what some of the other panelists talked about, the feelings of isolation and loneliness triggered people to relapse and fall back on their addictive behaviors. On the other hand, on the positive note, we saw many people who were actually drawn back into the program and attended regularly to some of our online meetings just because they needed that extra support system. So we've seen both people come back to the program, and we have seen where some people have relapsed due to the stress of the pandemic. So the overall communities have responded quite well in moving online. We have some meetings now that once people were allowed to start meeting, there are hybrid meetings. They're partially online and they're partially in person. And we have a few smaller meetings that are still just mainly online. And so with some of the ways that we're impacted outside of other groups is one thing is our anonymity complicates issues. So for instance, online meetings, the security for access to online meetings is an issue. One of the issues of anonymity we have to face, which impacts public health, is it makes it difficult to contact trace. So fortunately, we haven't had any outbreaks or within any of the groups that I'm aware of. But contact tracing, when you only know somebody's first name, it really creates a challenge, actually. And also, getting information out to people during this time has become a bit difficult. Fortunately, within the community, again, there's people from every strata of life that are involved in recovery groups. And so we had some people who had technical skills, quickly built a website, quickly got us access to online resources. The other important issue is when AA formed, and many of the other recovery groups, or what we call 12-step groups, actually formed their governance models on the very successful model of Alcoholics Anonymous. Basically, every group is autonomous. That means we do have a district level, we do have area levels, and then there's also the overall GSO, or the general service level, but there's no hierarchy, and every group makes up their own decisions and they decide for themselves based on a group conscience. And so that with no central point of control, each group really has to make decisions and policies on their own, and there is no policing of those activities. So that can really create challenges for the group. The other concern is what I think through the 12-step programs you learn is that if you want to stay sober and you want to gain your own sobriety, what you should do is help somebody else. And so service is a key aspect of 12-step programs. And one of the concerns is, and it can literally be a matter of life and death, is making it the challenge of somebody who needs a meeting and needs to become into a recovery program, not being able to find a meeting or access a meeting because of the pandemic. So one of the big concerns was, how do those newcomers, those people who are really on the edge and need help, how can they get access to our group? So that's been one of our challenges that other people may not have seen. So the other thing I think was a challenge is we rely on different places to meet, and each one of the meeting places, whether it's a church or some other facility, had different rules in terms of when somebody can meet or if they couldn't meet. So that was one of the other challenges the group faced. So in terms of just anecdotal evidences, we do know firsthand of some people who relapsed, not being able to get there because their support system was interrupted. But then again, like I said earlier, we saw people who maybe weren't regularly involved in the programs coming back and getting more involved. And our challenges are just like the rest of the society. I think Leslie said these well: isolation, loneliness, the inability to meet in places, place recovery at risk, which is why many of you will recall that in the executive order issued by the governor, recovery groups were quickly allowed to meet as long as they were with 10 or less people. And then something that many people don't think about one of the feelings that has to be medicated, and people will turn to a substance abuse, is boredom. And there's a saying in the recovery communities, one is halt, don't get too hungry, angry, lonely, or tired. But to that, I would also add boredom. And oftentimes people will seek out substances just because of boredom, which could be caused by being cooped up. So within the overall global recovery community, online meetings aren't new. They've been going on for telephone conferences. Then it moved over to later to web conference facilities for years. But locally, we didn't have that. And we've had a rich, we've had a real opportunity to have a lot of meetings, and we're very fortunate. But our local group actually had to quickly become familiar with online tools and online meetings, and it's actually gone quite well. So I just want to wrap up real quick with just saying, at the beginning, I talked about our community was a little bit, is basically just a microcosm of the overall society in general, with the exception of one thing. And that one thing that I think is really the key difference between those in recovery groups and overall society from which we're drawn is that, I think the people in recovery groups really have a decided advantage going into the pandemic because, they've committed themselves to a lifestyle that works towards emotional sobriety and recovery. And there's a set of tools and a process that comes with being in a recovery program that actually makes dealing with things like pandemics or some of the other social stressors that we have probably being able to deal with them in a more healthy way than I say people who aren't involved in the program. So I would say in some ways, those of us who by whatever reason, have found our way to the 12-step groups are some of the lucky ones in a time like this. And so again, if you think that you have an issue, there's probably a good chance that you should explore that further, and you might think about going to a meeting or finding a counselor. So dial help or just check the listing in the Daily Mining Gazette or call the AA hotline. So thank you.
Okay. Thanks, Jim. Real quick question for you as they're coming in from the audience members here. Kind of a global question here across the United States. We know in order to keep businesses, restaurants open, some of the policies regarding sales for alcohol have been relaxed. How do you see that impacting the local substance abuse and local recovery communities?
When you say relaxed, do you mean that they've increased the amount of alcohol or permitting alcohol or preventing it?
Permitting it.
Yeah, well, that's interesting because if you noticed a couple of the quick things that had to be allowed happen is alcohol and gambling, right? If you think about two of the highest risk places and you talk about super spreader events, both gambling facilities and places of alcohol consumption, yet there's such a level of alcohol dependence in general that people would, I almost think it became a matter of just managing social unrest. And it's very difficult to sort of put any kind of prohibition in place, as we know. So I guess my thoughts on that were probably those things were allowed to happen just because they couldn't be prevented. So, but you know what, we haven't. I don't think anybody in the recovery program would relapse because alcohol is suddenly available. One thing about addictive behavior, if you're going to want to use a substance, you'll find some way to do it, whether the bars are closed or not. So I don't think that really impacted things directly from the recovery community. Yeah.
Okay, thanks, Jim. Our next question, I'm going to direct this both to Amber and Dr. Amber Bennett and Dr. Kelly Cam here, talking about going into quarantine. So Dr. Bennett, I'll start with you. If a student is on campus and they have to quarantine, or if they have COVID and have to formally isolate, how is that in the short term impacting mental health?
So when students have to quarantine and they live on campus, they actually will have a direct contact with a professional staff member who lives within the residence hall. And the information is communicated to them very directly about the supports and services that are available on campus. We've had two different, at one point we had a group running all 5 nights a week, but there is a group that's running twice a week that is specifically for students who are struggling with needing to be in quarantine or in isolation on campus. And it's for an hour. It allows them to touch base, to connect, to talk about coping skills. And really, again, it gets back to that routine and having a way to get through that time period. There's also a 14-day quarantine/isolation guide that some of our psychology interns put together with my assistant director as well. And so it again gives them a guide to work through that 14-day period and to hopefully preserve their mental health.
I want to follow it up with Dr. Kelly Cam. So Kelly, can you remind us, I know this has come up during many of the previous town halls, what's allowed and not allowed when a student or a community member has to quarantine, and what they can do and what maybe they can't do?
Sure. So as Dr. Bennett mentioned, we try and make sure that the students on and off campus have a variety of resources to help them through quarantine. So when my contact tracing team reaches out to the students and our employees as well, we're giving them that information, including the 14-day quarantine booklet, and encouraging them that although they are under quarantine and they want to make sure that they are not having any more close contacts, that they still can go outside. They can go for a walk. They could, if they can get somewhere where they could go for a fishing trip where they're out by themselves, absolutely go for a hike, but you just need to keep that distance. It is a little bit different for someone who's isolating, who is actually infectious and known to be infectious. We definitely want to make sure that those people are not near anybody else. But we will work with individuals. And so we've certainly had cases where there's been particular needs, and we will work with the students to try and address those needs to make sure that their mental health is taken care of, as well as balancing that risk of them being in quarantine and potentially infecting other people.
Okay. Next question, a couple questions have come in. I'm going to direct this one to Leslie Griffith from Copper Country Mental Health. So Leslie, the questions here are dealing with grief and loss in general. And so what resources or support groups are available in the community if somebody's dealing with a loss and grief, tragically for somebody who's passed away, and even just dealing with, as Amber said, loss of a certain aspect of their education or other things. So what resources do we have here locally?
I am not really sure. I know that at one point, one of the hospitals was having a grief support group, but I don't know if any of those have changed with the pandemic. There are certainly resources that we provide to people individually. And again, depending on age and developmental stage and the need, we would often look for individual resources. I'm not sure if anybody else on the panel is aware of other local resource groups.
We'll move on to the next question. Thanks, Leslie. This question is for Dr. Kevin Trewartha. Dr. Trewartha, you talked about very briefly brain fog, and can you break that down a little bit more? What is that, or at least what we know or what we think so far?
Yeah, so I mean, brain fog is a kind of I guess a weird term and not really a proper medical or scientific term really, but it really just boils down to sort of confusion and disorientation and feeling that sort of feeling that you get sometimes when you just don't feel like you can focus normally. And I think that can come just generally with having a fever that comes with COVID-19. It can be something that happens if you're just not sleeping very well because you're having breathing problems. And so there's a variety of reasons why you might have that sort of brain fog experience. And I think people would probably define it slightly differently, but largely it's related to just difficulty with attention, confusion, hard time focusing, that sort of thing.
Okay. Thanks, Kevin. Next question is for Dr. Kelly Cam. We know you've talked a lot about quarantining and isolating. We've heard how the pandemic is impacting our mental health. I want to shift gears slightly and think about the holidays coming up, Halloween, Thanksgiving, Christmas, and try to keep a positive note here for a minute. But what recommendations do you have, this person's asking, to engage in those activities coming up over the holidays, but still following the public health guidelines?
Absolutely. So the importance of our rituals and our holidays are critical to us as human beings, and being able to in some way celebrate that with the people that we love is definitely an important part. CDC has some great recommendations for how to do Halloween a little bit safer. They have things separated into lower risk, moderate risk, and high risk. Certainly the door-to-door trick-or-treating is a higher risk. And so if the communities can come up with other ways, my children were disappointed to hear that the normal downtown trick-or-treating wasn't happening, but yet understand why it's not happening with the massive crowds that come there. So there's a lot of different ideas. I also recently found a Halloween website that's halloween2020.org, and it has you can pick at your community, and it ranks your community by risk level, and then gives a bunch of different ideas, like having you could do an outdoor haunted house. That's one way that you could make sure people are physically distant, wearing their masks. Indoor things, large groups we want to stay away from, but doing those things outdoors in small groups, and really talking to the people that you are celebrating the holiday with, and having those discussions about what are the risks to that discussion. What are you bringing to them, and what are they potentially bringing to you?
Thanks, Kelly. One final question here, and I'll direct this one as we're starting to wrap up here for Dr. Amber Bennett or Leslie Griffith. We've got into this habit of showing these infographics here on the screen for our viewers. If you're out there on the radio, we're showing kind of a visual here of steps to guide people if they need help with mental health. These are from the National Institute of Mental Health. And maybe Dr. Bennett or Leslie, can you just talk about this website or other places that are really good resources that you encourage community members to seek out?
Yeah, I can start, and then Leslie can finish. For college students in particular, if you go to mtu.edu/wellbeing, and there is a dash in between well and being, we have a lot of resources on our website. We're really trying to focus a lot more on well-being and the things that we can do. The other thing that I stress is that when somebody starts to feel like they're not able to get up, they're not able to get out of bed, they're having difficulty doing their activities of daily living, they're not enjoying the things that they normally do in terms of social activities and things like that, those are the warning signs where it's really important to be reaching out, trying to get connected to mental health support as well. But then also making sure that you're going to vetted websites to get information like the CDC, like World Health Organization. SAMHSA is another great resource as well.
The only other ones I would add are NAMI, the National Alliance for the Mentally Ill, have some really great resources. And then just thinking about some of our children, Sesame Street has some wonderful resources about COVID. And pretty much any national organization that is connected to mental health has some good stuff.
Well, thank you to both Dr. Bennett and Leslie for again, helping us get the correct information out there and directing people to these helpful resources. Each week we'll continue to build upon our topics here. I just want to wrap up with a couple of announcements. For those of you watching on Zoom and Facebook Live, we've sort of coupled together the last two town halls with kind of infographics here on how to stay physically active and healthy, and also thinking about our mental health this week. I need to thank all of our speakers: Leslie Griffith, Dr. Amber Bennett, Dr. Kevin Trewartha, Dr. Kelly Cam, and Jim, our guest tonight. We really appreciate your insight, your expertise, and everything, of course, that you're doing for the community. Finally, thank you to our sponsors: UP Health System Portage, the MTech Smart Zone, Upper Peninsula Power Company, Aspirus, and the Physiological Society. I want to thank all of our viewers out on Facebook Live, on Zoom, and our listeners on 97.7 The Wolf. We really appreciate your interest and enthusiasm. To give you a preview, next week, we'll be back same time, 7 p.m. Eastern. Our topic will be how the pandemic is impacting teaching and learning. We'll have representatives from our K-12 schools, our colleges here, Finlandia and Michigan Tech universities. We'll have students, teachers, faculty, and administrators here. So it should be a very interesting town hall. Remember, if you did miss any of our broadcasts tonight, you can go to mtu.edu/health-research. Just click on Town Hall and you'll be able to see the recording from tonight. Thank you to everyone working behind the scenes to help us with the platform here. Kelly and I do appreciate your support in helping make this possible. So have a great rest of your evening. Stay healthy and be safe, and we'll see you next week.